I'm Dr. Okky, the Medical Director for Renewal Technologies, a company that's bringing a revolutionary new product to the market. It is FDA cleared for the treatment of chronic intractable pain, post-traumatic pain, post-surgical pain, and pain of musculoskeletal origins. Not only prescription cleared, but also over-the-counter cleared. We're very excited because this product is really a product that's simple to use, yet has all the science behind it. If I may just show you, this is the box it comes in, and if you don't already have one, hopefully you will have one soon. The device, as I mentioned, is portable, it's handheld, it is ergonomic, and it has several features that make it easy to use. One is it has a simple on and off button. If you leave it on, it will stay on for about a 2-minute cycle. And the reason we did that is because we found that 2 minutes in any given area of pain seemed to be adequate to stimulate and facilitates the tissue, i.e. the cells, to start working again. The other feature it has a simple adjustable wheel on the side that manages the microelectric current intensity. And so between the two, as I mentioned, cold level laser or low level laser therapy, as well as microelectric electrical stimulation, being a hybrid, we're also the first device on the market with both. And the key is that both modalities can be used at a very, very low level. Now, this is backed up scientifically by a Harvard review study that looked at many cold laser studies and showed that the lower output actually had more benefit in helping cells work better than the higher output, as well as the electrical stimulation. Again, in the microcurrent range, work far better than when you stimulate it in the millicurrent range, which is 1,000 times stronger. So the device is very safe. The device can be used multiple times a day as a result, and you can use it in virtually any area in the body that has to do with soft tissue. So when you're talking about the tendonitis or muscle aches and pains and so on and so forth, you can use it on these areas. Many people in pain have multiple areas also, so they can use it in all these different areas. The device is rechargeable. It comes with a simple charger that is specifically made for this unit. It plugs in the back. The voltage adjustment on this is automatic, so you can go from 100 to 240 volts. In other words, you can travel. I've taken this all over the world and been able to plug it in anywhere. And an overnight charge will give you probably about 4 to 6 weeks of use, which is very, very handy and convenient. Because it uses electrical stimulation, it does require what we call an electrolyte conductive gel. This is a private label gel that's made specifically for this device, and it allows a very minute current to penetrate the skin. Skin has natural resistance, so without this you would have to turn it much higher, which would basically go against the idea of using a low current. So you put a little gel at the end of this tip and show you how easy it is to use. I push the button and I will test these or adjust the electricity in an area that I'm not treating. For instance, I will be treating my elbow for a golfer's elbow, but I would test it here or on my cheek. So right now, as you can see, the light is on, which means that the device is turned on, but the electricity has not been set yet. And so this little dial goes from a negative on this side to a positive on that side, and I turn it up with very, very slight increments. So I feel a slight current. And now I feel a current, just a very slight tingly sensation. No pricks, it's not uncomfortable. And if I have enough gel, I can now move to this area that I'm going to treat. And here again, as I treat the area, if I go over certain spots, I feel a little bit more current sometimes, and that's a good indication because I'm over usually the problem area. And as I treat that, I may move my arm and see how that feels, and after a while I may test it. And by the way, as I mentioned, the 2-minute cycle is adequate for most areas, but if I have to, I can repeat that and do multiple times too. The other thing that you'll also find that if you treat an area like this, very often you will have to treat the muscles that go down from there or go up from there, because this is an attachment area where the pain is in most cases, but it could be the tight muscles that are causing the irritation of pulling. So it is very simple to use. It is, as I mentioned, ergonomic, and when I'm done, I just push the button, turn it off. It's a good idea to turn that little wheel here all the way back to negative, so when you use it again you don't get surprised because the current is already on and it sometimes may be a little higher than you like it. I also use some simple alcohol wipes that you buy in the drugstore and disinfect the tip, especially if you use it between multiple family members and in some cases friends and so on. Just clean it and wipe it off. Suggest to store it in a nice environment. Don't leave it in your car trunk when it's too hot or too cold because you're dealing with a battery, and so treat it with care and get the best out of it. And I certainly wish that you can help all your pains. Thank you.